On this episode of TLC Connections, we're joined by Reggie Newson, CEO of Wellpoint Care Network, one of Wisconsin's most established and impactful human service organizations. Reggie's journey spans public service, state leadership, healthcare, and now community transformation at the helm of a 175-year-old organization dedicated to helping children and families thrive. He shares how growing up in Milwaukee shaped his commitment to service, the lessons he carried from government to healthcare, and his vision for addressing today's most pressing community challenges. We also explore Wellpoint's partnership with TLC and how strategic collaboration can amplify impact and help families flourish. We hope you enjoy the episode.
Welcome to TLC Connections, the podcast where educators, counselors, coaches, and community leaders come together to inspire change, one connection at a time.
Reggie, welcome.
Thank you.
Thank you for coming in. I know it was, you flew in, I guess, to Philly, is that right?
Yeah, I flew in this morning, got here this afternoon. Said I would come in and do this podcast with you on the front end of a trip to D.C. Actually, I'm going to Washington, D.C. tomorrow morning to do some visits on Capitol Hill and spend some time with some of my colleagues and other organizations as part of our Chamber of Commerce event in Washington.
Yeah, so tell me a little bit about that. Well, first of all, where are we coming from? Coming from the great state of?
Great state of Wisconsin. Milwaukee, Wisconsin.
Okay, and that was a direct flight, I'm assuming, into Philly?
No, I couldn't get a direct flight, interestingly enough. I had to fly into Nashville.
Okay.
And then the connection to Nashville to here.
Okay, and then a train ride tomorrow?
Train ride tomorrow.
Okay.
I've done that train ride between Washington and Philly a few times, so it's pretty convenient.
Yeah.
Yeah.
Well, let's, for the audience, I want to go back in time a little bit. So start with Wisconsin. How did you get to Wisconsin? What have you been doing in Wisconsin? Talk a little bit about Wellpoint. And as the audience knows, you're the CEO of Wellpoint. So talk a little bit about you, Wisconsin, and Wellpoint.
Sure. Well, Milwaukee, Wisconsin, a great place, great state. Born and raised in Milwaukee, Wisconsin. I've lived in a few other cities throughout the country for very short stints of time, but Milwaukee's home.
Born and raised there.
Born and raised there.
I did not know that.
Yeah. My family's there, and Milwaukee's a great place. And so I've decided to stay in Milwaukee because in the past, when folks like in my generation thought about Milwaukee, they left and never came back. And for me, it was important to stay there because I wanted to create roots there.
So that surprises me a little bit because of the size of Wisconsin. So I grew up in a small town, 500-ish people, one blinking yellow light, and people did want to leave and not come back because there literally wasn't there. But Wisconsin, I just recently visited Milwaukee. Yeah. And Milwaukee's a beautiful city. It has a lot to offer. Why is that people wanted to leave? Or has Milwaukee just grown significantly since you were a child?
Well, it's grown and changed significantly. And Milwaukee is a great city, a great place on a great lake. A lot of amenities there. Milwaukee is probably the biggest, smallest town you can probably think of in the country. So everything's there. But it has some unique challenges and some problems there. And certainly, I know when I went to high school, a lot of my high school classmates did decide to leave and then come back. But I didn't want to follow that path because I believe in Milwaukee. I live there. I love it there. And I want to be a part of the generation that addressed and try to solve some of the challenges that we have. So I decided to stay.
Well, obviously it's very close to Chicago. Would a lot of people move to Chicago or?
Oh, they moved throughout the country.
Just wherever.
Yeah. I know that my family, my dad and my dad's uncles and my mom, they migrated from a place called Hattiesburg, Mississippi, Columbia and Hattiesburg, Mississippi. In the 60s, early 70s, because through the Great Migration, a lot of Black Americans moved north because of a lot of manufacturing jobs there. As a matter of fact, my dad and his uncle stopped in a place, I can't think of the name of the place, but it was a Job Corps in Tennessee. And they became trained in MIG and TIG welders. And they came to Milwaukee, walked to a manufacturing company and got hired on the spot.
Wow.
And so a lot of folks migrated from the South to Milwaukee during that time. And it was the place to be. In the late 60s, early 70s, a lot of manufacturing jobs there. If you got skilled trained, My mom did CNC machining, became a CNC machinist, got hired at a job on the spot. And so during the time as the economy changed, I think folks decided to leave, again, coupled with some of the unique challenges we have there around the economy and other things.
So you come from mostly like a blue collar kind of manufacturing type family?
Yes. Yeah. So my family, I come from a family you had to take a shower when you got home from work.
Wow.
Yeah.
It's got their hands dirty.
Yeah.
Hard.
Yeah.
So then I'm assuming then you're the first generation college student from your family then?
Well, I'm the oldest of several siblings, and my dad and my mom. Yeah, I am the oldest and the first one that went to college.
The first one to go to college.
Yeah.
So growing up in a home where it was blue collar trades, do you remember or recall a moment in time that you said, "Hey, I want to do something different. I want to go to school. I want to go to college. I want to further my education"?
Well, certainly seeing my mom and dad, and growing up, particularly my mom, who never missed a day of work, taught me great work ethic. And certainly I watched my mom work very, very hard every day. So it motivated me to want to go to college and try something different, but also get into service where I can do things to be a utility, useful to others, and be of service to other folks to help lift them up and help them flourish.
I've told this story before, but in my own journey, I can recall a specific moment, like in the 8th grade, that was kind of pivotal for me in deciding to go to college. Do you recall a specific moment in time, or a person or a conversation you had, or what led you on that path to higher education?
Well, that's a great question, GT. Certainly, growing up, I did well academically, but I really didn't know I was doing well academically. I was smart. I was in different academic programs. There was a program called the Program for Academically Talented in elementary school. And when I went there, I had a teacher. His name was Mr. Turk. And he was the 4th, 5th, and 6th grade teacher in this program that I was in for the academically talented. And he was the one that motivated me. He said, you know what, you should think about getting more into academics and things that are going to challenge you from a rigor from your mind standpoint. And I didn't know anything about it, because if you don't see it, you can't be it.
Right.
And so certainly having him in the 6th grade tell me, think about doing this in middle school, that put me on a path to want to pursue academics and go to college.
Okay. And at what point in that journey did you know what you wanted to study? And what did you end up studying? So
in high school, I took a lot of different classes, and I had another teacher. His name was Mr. Speaker, and he was my political science teacher.
Okay.
And I did fine, but this class, I really excelled. And
did you say political science?
Political science.
Mr. Speaker?
Mr. Speaker. Mr. Speaker in political science class.
That was funny.
Yeah. And I did very, very well in the class. Right. And it just put me on a path for wanting to learn more about politics and government. And so that's why I studied in college, undergrad, grad, and I ended up getting a business degree, MBA too. But that put me on a path for wanting to be involved in the service.
Okay. Well, I know we don't want to necessarily dive into politics. I don't want to get into politics either. But I'd be remiss if I didn't, mention your political career. So maybe you just mention that just briefly. Yeah.
Sure. Well, I've been involved in working for various elected officials at every level of government, local, state level, even the federal level. And so I've worked for Democrats, I've worked for Republicans in the past, which I think about myself, I'm a problem solver. So I want to solve problems. I want to do it from a policy standpoint. I want to do it from an administration standpoint. So I've been able to navigate both sides of the political all in my career.
Well, you mentioned the MBA also. So how does that tie in? I don't know a lot of politicians or people with poli-sci backgrounds that also have business degrees. Explain how those two got married together.
Well, certainly I believe in good governance and good government, and making sure government delivers services at the most efficient point and has the greatest reach and impact. And certainly if you think about the perception of government, which there are a lot of talented people that go into government and public administration. I wanted to make sure I had the skills and the ability to be able to operate in the most efficient way for the taxpayers.
Right. So talk a little bit about where you went to school. Was that in Wisconsin, or did you leave the state to go to school?
Actually, I spent 1 year, again, because I have family in Mississippi. I went to Jackson State for a year, Jackson, Mississippi, a historic black college and university.
Okay.
And decided to come back in. Milwaukee's home. So I came back and finished my undergraduate at University of Wisconsin, Milwaukee, did a graduate degree there in political science, and then went to a Lutheran school, Concordia University of Wisconsin for my MBA.
Okay.
Yeah.
Talk a little bit about your college experience just in general. You mentioned a couple of teachers that were very instrumental in sixth grade and later in high school. Any college professors that you recall like changed maybe challenged you or changed the way you thought about something?
Yeah. One professor, his name is Dr. Douglas Erkey. Actually, he and I published a paper together because at the time I thought about maybe going into pursuing a PhD and going into academic, being a professor. But certainly he is someone that I considered a mentor when I was studying undergrad that introduced me to a lot of different things. Actually, he connected me to a internship with the city of Milwaukee government. And I did internships there in a variety of different departments. Again, got some great experience during the time. So I would attribute those connections and relationships. And again, if you can't see it, you can't be it.
Right.
But he opened my eyes about a pathway working in government.
Wow. So was that your first job then, kind of out of college then? Was this internship for this political?
One of my first jobs, was a position I did for the city of Milwaukee Fire and Police Commission as a safety coordinator.
Okay.
And I did that for a period of time and then got into other roles in government. And actually, my first job as a manager or as a public administrator was with the Wisconsin Department of Transportation, where I worked as a operations director for the highway division. So I oversaw a team of engineers and it was responsible for designing and maintaining a highway system in southeastern Wisconsin.
Okay.
Yeah.
And you were doing that in your 20s and 30s?
Early 30s.
Early 30s.
Early 30s.
All right. So take us through, continue taking us through the journey. So from there, where, and then eventually take us all the way to Wellpoint. And
Sure. So I spent a better part of 20 years in state service and worked my way up. My first role in state service was, again, with the Wisconsin Department of Transportation. Worked my way up to a manager role where I oversaw our minority business enterprise program for the state of Wisconsin. So helping women, veteran, and minority-owned businesses, both on the construction contracting side, but also the design consulting side, do state work and supporting the growing minority businesses. I became operations director for the highway division region in southeast Wisconsin. Spent several years doing that. And then Governor Scott Walker, who's governor of Wisconsin, he was elected. I served in his administration. I started off as the assistant deputy at DOT, so I got kicked upstairs as a political appointee.
Okay.
I did it for a short period of time, and then the governor appointed me deputy secretary of an organization called Department of Workforce Development. I did that for a short period of time, and then the governor appointed me secretary for Department of Workforce Development, where I served in his administration, in his cabinet for several years. And then I transitioned for that. Actually, when I worked for Workforce Development, spent a lot of time with the Wisconsin Hospital Association, which is the largest trade association for hospitals, one of the largest in Wisconsin, and on working on workforce issues, helping recruit clinicians and folks to go into healthcare, develop a relationship with the previous CEO of the Hospital Association, and actually Ascension, Wisconsin. Ascension is one of the largest health systems in the country, and they became a instead of a holding company of health systems in Wisconsin, an operating company. And changed the brand. They were looking for someone to do government and community relations there. Through a connection from the Hospital Association CEO for the Wisconsin market CEO of Ascension. They knew each other. He had just landed. Actually, he's from Tennessee, Nashville.
All right.
And they were looking for someone, relationships, connections. And I became Vice President of Government Community Relations for Ascension. I did that for 10 years in a variety of different roles. I went from that to President of the Foundation to Vice President of our Community Impact Programs.
Let's go back to your government work for a minute. So you started with this as a safety coordinator, did some transportation, workforce development. What, did you say 20 years in government?
No, nearly 20 years in state government.
Is there any particular period of time or any particular role that you look back on was like you really made a difference or you had a passion around? Because it sounds like you have a varied experience. I was just wondering if one of them you were more passionate about than the other, or is it the same type of skills that are applicable to all the roles and you just enjoyed them all? Yeah.
I would say applicable to all, and I enjoyed them all. I do think about the impact I've made in my career in state service. Certainly when I work for the Department of Transportation, I'm very proud of the work we did to help women and minority and veterans-owned businesses do work. Actually, at the time, we were working on one of the largest state reconstruction projects in the history at the time, the Marquette Interchange Project, central to commerce in the state of Wisconsin, but in Milwaukee. And on that project, nearly $1 billion project, we helped minority and women-owned businesses, veteran-owned businesses accomplish 20% of the contract, either through hours worked or contracting opportunities. So it created jobs and economic prosperity for the community there. So something I'm very proud of. At the Department of Workforce Development, when I served as secretary, certainly through innovative training programs and working with employers to train individuals, post-secondary, colleges, universities, tech colleges, K through 12, we were able to create some economic opportunity and jobs for nearly 10,000 Wisconsinites. And that happened under my stewardship at Workforce. So these are family supporting jobs. So something I'm very proud of. Yeah.
And then going back to Ascension for a minute, that is a hospital healthcare network. So that's even different than transportation or workforce development. Yeah. So any particular moment in that work that really sticks out?
Sure. Great work there where we raised a lot of money to help folks that are vulnerable in the community get access to healthcare. Healthcare is something that's critical to all of us.
Right.
And certainly very proud of that work, as well as investments that we made in the community there to help. If you think about the work around healthcare being outside of the hospital four walls, being in a space where you help individuals get access to food or education or housing, investing in partner organizations that created stability for vulnerable folks so they wouldn't have to use the health system as much, which creates a strain on all of us.
Right.
Certainly, I'm very proud of that work and hundreds of people that we help serve there.
It was Wellpoint next?
Wellpoint's next,
Okay, all right. Talk about that transition and then just take a few minutes to describe to the listeners who Wellpoint is, what the mission is. Talk a little bit about that.
Sure. So certainly great service at Ascension. I loved it there. And again, did a lot of great things. GT, I always want to be in a position where I'm purpose-filled, doing something that's unique and being a utility and helping people thrive and flourish. And certainly the opportunity at Wellpoint to become the CEO to succeed my predecessor who served 30 plus years there, did fantastic work and really created Wellpoint and built it up to where it is now. It was a great opportunity. Wellpoint is a human service organization in Milwaukee, Wisconsin. We're celebrating our 175th year.
It's a long time.
Yeah, one of the oldest organizations in the state of Wisconsin of helping heal, helping families learn and thrive both children and families flourish. That's our mission. And certainly with the mission, again, around things we call the 5 pillars of sustainability, access to community connections, education, employment, housing, and healthcare, both mind, body, and spirit. It was a great place because part of our strategy is we want to create a neighborhood hub in the city of Milwaukee at the Wellpoint campus where we have like-minded synergistic organizations like yours, the Lincoln Center, come in to provide resources and support. And we have 18 acres. Most organizations like ours are very land rich. And so how do we develop 18 acres to meet the highest and greatest use of the neighborhood and the community of Milwaukee, and what does that look like? And so certainly I saw this opportunity to come in and do some good over the next journey, next chapter of my career. And so Wellpoint was a great place to come and
as you mentioned the 5 pillars, I think it's kind of cool that as you look back in your career, how those pillars, each of those pillars were like points in time in your career, and then Wellpoint's like putting it all together.
Yeah. My purpose-filled GT, building opportunity, strengthening community, and enriching lives, and those have been my pillars, my themes, and my purpose. And so every role I've had in my career, I've had a chance to build opportunity. I left it in the community in a better place. I strengthened it, and certainly helping people flourish and enriching their life.
If you think about the 5 pillars, what's the biggest challenge right now? Is there one of the 5 that's like the hardest like nut to crack?
I think all of them have their own varying degree unique challenges. Certainly, if you think about just the hierarchy of needs, making sure people have a place to stay,
right,
and access to food. So housing is really, really important. Affordable housing,
right,
and with inflation and things that have happened over the last several years, some of the price points for folks, whether they're young professionals or they're vulnerable, and accessing affordable housing has been a challenge. So that, and employment and education. So in healthcare, so they are various degrees of uniqueness in terms of challenge.
Those are all complex issues, hard to solve.
Otherwise,
they had been solved a long time ago.
Yeah. If they were been solved, I wouldn't be sitting here right now.
For someone who might be listening who is younger, maybe even high school or college, and they're inspired to want to help in their community, other than the passion, which you talked about, what else do they need besides the passion? Like what advice would you give them in terms of education? Would you recommend like the political science route, or the business route, or social work counseling route, or the education route? I know there's needs for all of them, but it's such a complex issue. Where are the gaps for solving some of these issues? Like,
I think it's this lack of exposure and information. Certainly, there are a lot of opportunities out here and available to folks. Something I learned at workforce development is that the vast majority of the jobs, and the way the industry and the market and the economy is changing, don't require a 4-year college degree.
right,
So they do require high school or some increment of credentialing at the high school.
right,
And certainly I would encourage young people that may see college, or, I don't need to go to college, or that's not for me, that there are plenty of family supporting jobs and opportunities out there that are needed in the market, in the economy, for individuals that got to finish high school,
right,
but then go on to a technical college or an apprenticeship, or getting some type of unique credentialing, stackable credential in the area of interest. And so that's opportunity right there.
right.
And certainly when you get there and you do that, certainly we need folks to invest in their neighborhoods and their communities, because if not you, then who is going to do it? And certainly through volunteerism, through the spirit of helping their neighbors, I would encourage folks to do that, because if you don't, we can't sustain what we currently have, which I think is really, really good. And again, there's a lot of opportunities out there. And again, things have gotten better, but there's still work to be done.
Yeah. My daughter had a passion to just really want to make a difference. And she came to me as the dad and said, hey, what do you recommend? And I had to struggle with that question. It's like, how do you make the most change? And, she mentioned education. Should I go be a teacher? Should I go the legal route and try to change the laws to make lives better for people? And so you can serve in so many different capacities. And at the end of the day, I knew her passion was truly working with youth and working with children. And I also knew that mental health was an increasing problem. There's not enough mental health workers to meet the demand or to meet the need. And so ultimately I recommended that she go into working directly with children on mental health. And so that's what she did. And she absolutely loves it. Will she change society in that role? That's arguable, but she's changing like one life at a time, just one little small life at a time. And so I think by going through that journey with her, I just basically decided that the answer is whatever you choose, just focus on that one life at a time. And you never know what the impact of that one life may lead to.
Absolutely. I love that. And I think that's spot on. And certainly at Wellpoint, as part of the work that we do, is that we work with families, and we want to help families thrive and flourish. And ultimately, we work with a lot of vulnerable families and families that are going through some heartache and some hardship at the time. And so our goal is when that happens, that we want to support them, reunify them, provide them with knowledge, information, and resources. And certainly when you think about prevention and intervention, I really love the story about your daughter going into working with young people and going into behavioral health, right? Because issues around trauma and behavioral health, we have to continue to work to destigmatize those things, right? Because we all need access to that. And at Wellpoint, that's part of what we do. Our behavioral health service line, mental health and wellness, and trauma-informed care. So raising the specter about what trauma is and what trauma is not, destigmatizing it, and then helping other people have expertise to go out and train folks around trauma, whether it be police, fire department, healthcare providers, employers, to be able to recognize the signs of trauma and help individuals, again, get past the heartache or hardship, coping, building perseverance and resiliency skills, and ultimately, again, destigmatizing those things.
Yeah. As you're describing Wellpoint, I can't help but to think of the Lincoln Center. Our missions overlap in a lot of different ways, and we use some of the same common language as well. And I'm assuming I haven't seen our two mission statements aligned side by side, but I'm assuming there's some overlap there.
There's some overlap. I did look at that.
Yeah, and so the next set of questions has to do with like strategic partnerships. And so in the business world, which I spent a big chunk of my professional career in the business world, it was less about collaboration and cooperation and more about competition.
Right.
And you would have certainly learned that in your MBA program, right? And so, but in the social enterprise world and the nonprofit world, there's a need for collaboration and cooperation. Talk a little bit about your partners that you partner with in Wisconsin, and talk about the Lincoln Center partnership, which is fairly new. And I'll chime in as well and add some context there too.
Well, GT, I'm glad you brought that up, because in the private sector, when a business wants to grow, scale, reach, impact, touch a segment of customers or gain market share, they merge, they acquire. And in the nonprofit space, we need to follow kind of that same playbook, where if we truly want to follow our mission, we have to build strategic alliances, partnership. We have to affiliate with organizations that are synergistic, and our missions are very synergistic. And so my philosophy is that we have to collaborate. We can't do this work alone.
Right.
And if we're going to have the greatest impact, true reach, to help as many people as we possibly can, we have to combine smartly and support each other and again, partner smartly.
Right.
And so I'm just so excited about the partnership between Wellpoint Care Network and the Lincoln Center, and certainly the work that you're doing here in the greater Pennsylvania area, but also in other states, really makes a lot of sense. And certainly as you want to grow reach and impact, your partnership working with Wellpoint in Milwaukee, Wisconsin, when you're coming in to provide support and resources to the families that you're serving, makes great sense. It's a great partnership for us because you're going to be a part of our neighborhood campus where our 5 pillars, education and helping create stability there, resources into the building where our families serve. And certainly we're partnering around behavioral health services. And so it's just very unique and it's great. And I envision GT growing and expanding that. And anything that we can do to help you grow and expand your reach and impact through the work that you're doing in Milwaukee, Wisconsin, we want to be a part of that, because when you grow and flourish, more people are going to flourish, and our families are going to flourish, and we can have better reach and impact for the people that we're privileged to serve.
Yeah. Yeah, I'm going to repeat something that was said a little bit earlier, which is to use a microeconomics term, the supply and demand curve, there's an inefficiency there. There's a lot more demand for educational, mental health, and behavioral health services for the underserved than there are organizations like Wellpoint, like the Lincoln Center. And so, yeah, it's a great opportunity for like-minded organizations to partner and tackle, as we mentioned earlier, complex issues.
Right.
And so, yeah, we're thrilled to partner with Wellpoint as well. Well, thank you so much for your time. Thank you for taking the special trip. I mean, because this was not part of your original journey. You were going to D.C. You did a detour to come visit us, and I really, really appreciate that. I'm thankful for your time.
No, thank you, GT. And this partnership is really important to us. And so I want to come out here and see your shop and do this with you. And again, I look forward to building a stronger, positive, productive relationship with you in the Lincoln Center.
Same here.
Yeah.
Thanks.
TLC Connections is supported in part by the Lincoln Center for Family and Youth through education, counseling, coaching, and consulting. We empower people to make positive choices, meaningful connections, and transformational change. To learn more, visit thelincolncenter.com.